talk about neutropenia. Now, remember that penia means low or decreased, right? Neutro refers to a neutrophil, which is a type of the white blood cell, the one that helps us fight infection. So the signs and symptoms of neutropenia are going to be low and hot. That means they're going to have a low white count and they'll have a fever. It's not going to be a high fever though. They may have signs and symptoms of infection. But somebody with neutropenia, since the neutrophils are the ones that cause us to have a fever, but also cause us to have like purulent drainage. Your patient could have an infection without purulent drainage. Okay, so we have to look for subtle signs of infection. Now we're talking about neutropenia as it relates to bone marrow suppression after somebody has chemotherapy. Around 2 weeks later, their bone marrow is going to be suppressed, so they're going to have low red blood cell counts, right? Which results in low hemoglobin hematocrit, so they'll have anemia. They will have low thrombocytes or platelet level, which is called thrombocytopenia, which puts them at risk for bleeding. And they're going to have low white counts, so we call that neutropenia, and they're going to be at risk of infection. So this is what bone marrow suppression causes. So the complications of neutropenia include the patient can get an infection. You might not even know. No, it may be subtle, may not pick up on it right away, and then the patient becomes septic, okay? And they have sepsis, and they can go into septic shock. When people are in septic shock, they can develop what's called DIC, disseminated intravascular coagulation. So this happens in a number of conditions, and you're going to learn about it too in maternal child, because it can happen after childbirth for certain reasons. Okay, so DIC is like a condition that happens when another condition is present. So in this case, I'm talking about septic shock. The patient can develop DIC. And what DIC is, something trips up the clotting cascade. So the patient is going to clot and bleed and clot and bleed and clot and bleed. So what you're going to see first is probably some oozing from the IV sites. And they could potentially bleed out from that. Okay, so let's get back to neutropenia. You need to report a fever greater than 100 degrees Fahrenheit. You have to teach your patients to take their temperature daily and report a temperature to the provider of 100 or greater Fahrenheit. Obtain cultures before antibiotics are started. Monitor the skin and mucous membranes and avoid invasive procedures such as inserting a Foley catheter. Okay, you would never want to do that in somebody with neutropenia. When I worked in oncology, when we had patients that had thrombocytopenia and neutropenia, we did at shift change a head-to-toe assessment with the oncoming nurse and the offgoing nurse, and it was pretty invasive. I mean, we spread the butt cheeks, right, because that area of your body is not usually very clean, because we want to pick up on infections right away. Lift your arm up, looking in the armpits. I mean, we looked at every inch of that body together so that we could determine or we could identify early signs and symptoms of infection. Typically, chemotherapy is going to put you at risk for neutropenia, radiation treatment as well, which is often done for cancer. Sometimes immunosuppressant drugs, like if patient had like a transplant, maybe that could result in neutropenia. So the treatment, well, there are white blood cell stimulating medications that can be given. You want to prevent any injury to the patient, any further, infection. So the patient's going to be placed on neutropenic precautions, which is also called protective isolation. So the patient cannot have live plants in the room, no fresh cut flowers, because of the bacteria that it could bring into the room. And anytime you have standing water, there's a risk of a Pseudomonas infection. I don't know if you've ever smelled Pseudomonas infection. It's really rank smelling. And it's usually due to Pseudomonas is a water bug, so it can get into like the mechanical ventilation humidifier system. You certainly wouldn't want drinks for the patient standing longer than an hour because they can get infected from that. Restrict fresh fruits and vegetables. No IM or rectal temperatures or enemas or anything like that. And that's not because of bleeding like with thrombocytopenia. It's because you don't want to give an IM injection because the patient is going to have bacterial flora on their skin. So if you then give an injection, you're introducing that bacteria on the patient's skin inside the body, and they can get auto-contaminated by that. And that means they can get an infection from themselves, their own body bacteria. All right. Same thing, your rectal area is not the cleanest place, so you wouldn't want to insert anything in the rectum because they can get infected from that. They need to be in a private room. They need a mask to travel, like if they had to go out of their room for a test or something, they need to put a mask on. There needs to be dedicated equipment in the room, and that's to prevent auto-contamination and cross-contamination, because you're not going to take your stethoscope and take blood pressures and all your other patients and then come into a patient's room with neutropenia and use that same stethoscope. So everything, the equipment in the room has to be dedicated to that patient and that patient only. You're still going to clean it in between using it, but you're not going to take it out and put it in another patient's room. You're going to teach the client to avoid crowds. They need to take their temperature daily. They need to eat fully cooked food or tinned food, right, in a can. They shouldn't do yard work because they may come across bacteria. They shouldn't empty cat litter. They should wash dishes in hot soapy water. They need to wash their toothbrush daily in the dishwasher, okay? Or they can use like a 1 to 10 bleach to water solution to soak it. They should not share any personal items. So the diagnosis is made on a low white count. Specifically, the neutrophils will be 2,000 or less. The ANC, which stands for absolute neutrophil count, will be 1,000 or less. And there's a whole formula to get to that. You don't need to know the formula. You just need to know that a low white count or neutrophil less than 2,000 and an ANC less than 1,000 means the patient needs to be on neutropenic precautions. All right, don't get neutropenia confused with thrombocytopenia. So this patient with neutropenia will be at risk of infection.